COPD, or chronic obstructive pulmonary disease, is a condition that is characterized by persistent airflow limitation. It is usually progressive and associated with an enhanced chronic inflammatory response to noxious particles or gases. If we further review the pathophysiology of COPD, we note that noxious stimuli, and these are things like tobacco smoke or other environmental allergens, actually go on to cause damage in both large and small airways. The damage leads to airflow limitation, airway inflammation, airway fibrosis, and increased airway resistance. The inhaled noxious stimuli cause accumulation of inflammatory cells, and these include neutrophils, CD8 cells, T lymphocytes, B cells, and macrophages. These cells release inflammatory mediators including tumor necrosis factor alpha, interferon gamma, and several others as you see listed. All of these inflammatory mediators go on to activate the cells and cause chronic inflammation and tissue damage. All of this inflammation goes on to lead to airway remodeling, and airway remodeling is responsible for the classic symptoms of COPD. The airway remodeling produces airway narrowing, peribronchial fibrosis. There's a buildup of scar tissue from damage to the airways, which goes on to further produce narrowing, and then there's overmultiplication of the epithelial cells lining the airway. There is parenchymal destruction, which leads to a loss of elasticity. And for a patient with COPD, that means that their airways can't respond the way that normal airways would. And also, mucus-secreting cells, which are sometimes referred to as goblet cells, go on to replace healthy cells. And this is what causes a lot of the classic mucus overproduction that we see in COPD, which can cause the chronic cough that many patients have.